This is our presentation of Childhood Apraxia of Speech by Cheyenne Jones, Sloan Keenan, and Alicia Lopez. What is it? Childhood apraxia of speech is a motor speech disorder, or CAS. Individuals with CAS have problems saying sounds, syllables, and words. This is not because of a muscle weakness or paralysis. They have trouble moving their articulators such as the lips, jaw, and tongue, which are needed to produce speech. The individual with CAS knows what they want to say, but the brain has difficulty coordinating the muscle movements necessary to say words.
Some of the signs and symptoms of CAS. Not all individuals diagnosed with CAS experience the same difficulties. Not all signs and symptoms shown may be present in one child with CAS and may be present in another. It is very important to have your child assessed by an SLP in order to rule out any other speech disorders before proceeding. Signs and symptoms for very young children. The child does not coo or babble as an infant. First words are late and they may be missing sounds. Only a few different consonants and vowel sounds. Problems combining sounds, and they may show long pauses between sounds. Simplifies words by replacing difficult sounds with easier ones or by deleting difficult sounds, and may have problems eating. Signs and symptoms for an older child. Inconsistent sound errors that are not the result of immaturity, can understand language much better than they can speak it, may appear to be grouping when attempting to produce sounds or coordinate articulators, has difficulty saying longer words or sentences compared to shorter ones, has more difficulty when anxious, hard to understand for unfamiliar listeners, sounds choppy, monotonous, or stresses the wrong syllable or word.
Other problems that may present with CAS. Delayed language development, expressive language problems, word recall or word order confusion, difficulties with fine motor movement, coordination, oversensitive or undersensitive in their mouth, tactile like foods and toothbrushing, may have difficulty reading, spelling, and writing. Diagnosing individuals with CAS. A certified SLP with knowledge of CAS should assess the child's oral motor abilities, melody of speech, and speech sound development. Tests that can be used to assess individuals with CAS include the ST-DAS and the Kaufman Speech Praxis Test for children. Oral motor assessment. Checking for signs of weakness or low muscle tone in lips, jaw, and tongue. While children with CAS do not usually have weakness, checking for this will help make a diagnosis. Seeing how well the child can move the mouth by imitating non-speech actions. Evaluating the coordination and sequencing of muscle movements for speech while the child performs tasks such as the cytokinetic rate. Example, Pratica. Test the child's skills in functional or real-life situations and comparing this to non-functional or pretend situations. Melody of speech. Listening to the child to make sure that he or she is able to appropriately stress syllables in words and words in sentences. Determine whether the child can use pitch and pauses to mark different types of sentences and to mark off different portions of sentences. Speech sounds. Evaluating both vowel and consonant sounds. Checking how well the child says individual sounds and sound combinations. Determining how well others can understand the child when they use single words, phrases, and conversational speech.
Other syndromes that can accompany CAS. Other disorders and syndromes that can accompany CAS include autism, Down syndrome, various learning disabilities, and disorders that affect muscle tone such as cerebral palsy. Treatment of CAS. Most professionals stress the importance of intensive therapy 3 to 5 times a week, consisting of improving the planning, sequencing, and coordination of muscle movements for speech production. Improving all the senses will help the child with multisensory feedback. The child can more readily repeat syllables, words, sentences, and longer utterances to improve muscle coordination and sequencing for speech. Practicing at home is key to the child's success and progress. Families will often be given assignments to help the child's progress and to use new strategies outside of the treatment room.
Therapy of CAS. The child will need a significant amount of practice saying words and phrases during each speech therapy session and often focuses on the child's attention to the sound and feel of speech movements. Therapists may touch child's face to help the child make a sound and focusing on drills where the child say words or phrases many times. The child should listen, watch therapist's mouth so child sees movement along with sound and the child may be asked child to practice syllables, words or phrases rather than isolated sounds. They may practice vowels in different types of syllables, examples hi, mine, bite, and the therapist should start with small set of practice words, gradually increase number of words as child improves. Therapy of CAS continues. Very few recover on their own and have spontaneous recovery and no single approach has been proven to be most effective. Each therapy is tailored to the individual and is designed to treat other speech-language problems that may occur together with apraxia and each person's response to therapy differently. Some people make more progress than others. One-on-one intensive therapy is most effective and support from family and friends, plus encouragement helps a child's improvement.
Technology involved with CAS. There are many different forms of technology that you can use if your child has CAS. Argumentative and alternative communication devices are primarily used if the child with CAS is so severe they cannot produce speech. Devices and technology include apps for tablets and smartphones and a Dynavox system and a PEC system.
So this is the Dynavox system. It's basically like an iPad or a tablet that you would use. You click the images that form sentences and then you hit play and it plays a sentence back so that the child can communicate wants and needs. Some information about the Dynavox. Pricing for a Dynavox ranges from $6,625 to $17,290. But there is an app that is compatible with iPad, iPhone, and Windows tablets, and it's called the Dynavox Compass, and it's free for downloading, but there are other apps made by Dynavox that range from free to $159.99 that have a variety of features. So this is a PEC system. It's basically a word phrasing system. You have pictures and the individual can form the sentences on a sentence strip, which you see on the right hand side of the screen where the child is pointing, and they can combine the pictures to say things like I want milk, I want bed, I want to sleep, things like that. But then there is also a wristband that they can take with them when they go out, like one that says bus, friends, things like that that can help them function better in their everyday lives. And then there also is a device, kind of like the Dynavox, that kind of does the same thing. Some information about PECs. PEC systems range from $16.95 to $54.99. But if you want the actual device, it ranges from $69.95 to $10,000. But there is also an app for the iPhone, iOS, and iPad that ranges from $7.99 to $15.
Support groups for families with children with CAS. Some support groups include www.apraxia-kids.org, which is an online source for reliable and comprehensive information about childhood apraxia of speech for families, professionals, and all those who care about a child with apraxia.
Blogs of parents with children that have CAS. A few blogs that parents with children that have CAS may find helpful are www.scienceofmom.com, which recounts a parent's experience with CAS, and then www.bigjourneyapraxia.com, which also recounts a family's experience when dealing with CAS.
This has been our presentation over childhood apraxia of speech. We hope that you found all the information as informative and helpful as we did.